All right, everybody, let's get started. Thanks for jumping on today. We're excited you're here. Today, we are going to be reviewing our Incredible Health 2023 Healthcare Executive Report. We're really excited to reveal this data to you. We published this data, 2 or 3 weeks ago, probably now. And we're super excited to dive into the data and have a discussion about the data with you today. Our speaker today is our CEO and co-founder, Iman Abu Zaid, who's also an MD. She's done a ton of stuff. So Iman, why don't you give us a brief introduction to yourself, and then we'll get started.
Sure. My name is Iman. I'm the CEO and co-founder of Incredible Health. I'm an MD by background. I've been in technology for the last 10 years of my career. I started working on Incredible Health about 6 years ago. We've since grown to over 700 hospitals that we support, and 1 in 4 nurses in the US uses us to manage their careers.
Awesome. We're so excited about this webinar today as well. So let's talk through the agenda. We're just going to kind of do a quick introduction just about the nurse labor market today, what we're seeing, and then dive into the study results, spend the majority of our time there. We encourage you to ask questions as well on the webinar. We'll address those in real time, and then at the end as well, if there's any we didn't get to throughout. So go to the Q&A area on your screen or the chat area, and we'll address questions in both places. So first thing is, let's talk a little bit about the nurse labor market. 1 in 8 Americans work in healthcare. We know that it's the #1 employment sector and has been for a long time. We're seeing the demand for healthcare go up, but the number of workers in healthcare decrease. That's a national problem that's getting worse. The thing that I think is really crazy is this last stat on the right, the average time to hire a permanent specialized nurse. That number keeps bouncing around that 90-day range. It just takes a long time to hire a nurse. As we talk to hospitals, Iman, what is the thing that takes the longest? Is there one part of the hiring process or the finding process that seems to take the bulk of that time, or is it spread pretty evenly through every step of the process?
Yeah, so to clarify, the 95 days is a national average. We work with many health systems that are well below that, which is good for them. We also have health systems that are above that. And also, not all nurse openings are created equal. There are some nurse specialties that are particularly difficult to hire for that really extends that days to fill. Where we see the biggest delays is on time to source. Just finding the actual nurse can really elongate the days to fill. And then the other area that I would say probably 70% of the hospitals that we work with struggle with is really trying to accelerate how quickly hiring manager interviews are completed and decisions are made on sending out offers. And across the country, many teams are implementing best practices in order to accelerate that speed too.
Awesome. And the thing I'd point out here as well is the average hospital that uses Incredible Health to help them with nurse hiring is around 20 to 25 days. And there's some that are even far lower than that. So part of our really significant value prop as a company is helping you decrease that time in real and dramatic ways with qualified and experienced talent. So that's what we try to do, and that's why we study this so carefully. Okay, let's talk about the study. So this was a study that we ran in June of this year. So this is brand new, and we surveyed 100 US health system senior executives. So we're talking C-level people at large and small health systems around the US. And these were some Incredible Health clients, some that don't work with us. This was across the board in terms of the type of hospital and their experience with Incredible Health. So we tried to make it as broad as we possibly could and get the senior people in every single organization to answer these questions. And we asked probably too many questions for a well-written survey. I think we asked like 32 questions, but we did have 100 people answer the questions, which was awesome. And we'll link and actually after the webinar, send you the full report so you have that in written form, and we'll review some of the top findings today. The other thing too that we were talking about right before this call is the media coverage and the reactions to the study have been pretty dramatic. It was mentioned in Politico, in Becker's, It also got a lot of reaction from other senior leaders as well. And you were talking to some CEOs and CFOs and other people about this report, and they were not surprised by the data, maybe would be the best way to summarize it. Is that fair?
Yeah, absolutely. So we have a few reactions, some of which were published in Becker's Hospital Review, and then some just for conversations. So Janice Walker, the chief nursing executive at Baylor Scott and White, which is a big regional system in the Dallas area, said she wasn't surprised by these study results and believes organizations need to become more candidate centric in their efforts to recruit nursing talent. And we can't just rely on our reputations, but have to have very active and aggressive work streams in place to get the talent. Another reaction we had was Tommy Bassett. He's an MD, he's a CEO of Bassett in the New York area. And he was also not surprised by the results and believes that the paradigm is shifting in in how we design the nursing workforce, how we have to encourage nurses to work at the top of their license, but also we have to be implementing team-based models and focus on innovation and career development for nurses in order to prevent things like burnout. And so, yeah, there were a pretty extensive set of reactions. And, Janice Nevin, last one I'll mention, Janice Nevin, who's the CEO of Christiana Care in the Delaware area. This new study really quantifies the changes that they've experienced as well in attracting, hiring, and retaining talented nurses.
Great. Yeah, the reactions were awesome to hear. So we'll go through the data today. We're not going to go through every one of the 32 questions. We don't have time to do that, but we'll try to highlight a few that we thought were really interesting. And we're already getting a few questions in, and we'll kind of address those as we go as well. So first thing, nursing shortage remains critical. So 94% of the health system executives we talked to described the nurse system as critical, which highlights the need, obviously, for effective strategies to remedy that. This one didn't surprise us because we're hearing this from the hospitals we work with. We heard it from the nurses that we surveyed back in Q1. We did a really extensive nurse survey. So this didn't surprise us. I think the thing that maybe did surprise me was how high the number was that described it as critical amount. I don't know if you were surprised or if this was in line with what you expected.
So it definitely was in line with what I expected. What we saw, I think the timing of all this is relevant too. So coming out of COVID and all of that we all went through, that every health system went through, thought that this would get a little bit easier. Right. But in fact, the demographic changes going on in the US are sort of bigger and more powerful than even a pandemic, right? And the recovery from a pandemic. So what that means is that our population is aging. We, as a country, holistically, all of us have not done an amazing job of increasing the number of nurses needed to support that growing patient demand. And while hospitals and health systems are experiencing increasing patient demand and they're adding more facilities and expanding, they can't necessarily find the staff needed. So it hasn't gotten, this was from June 2023, so it just hasn't gotten better.
Yeah, great point. And also one of the things that we don't really talk about it in this presentation, but it is addressed in the survey, is some of the federal funds that were made available to hospitals during COVID have now kind of started to run out or have run out. And I think hospitals are figuring out how to grapple with that as well, while maintaining the programs and the staffing they had during COVID and trying to improve that as well. So that's some of this as well. All right, experience and tenure. So 40% of health system executives said that more than a quarter of their nurses had less than a year of experience. This one did surprise me. And then the other thing that I thought was interesting was this was the most common thing they look for. They look for experience. 43% said that's the most common thing they look for. But yet 53% of nurses at their institutions had an average tenure of less than 5 years. So you have people changing jobs more frequently. And then you also have just the total nurse population, perhaps less experienced than they have been. I wasn't surprised that the number was high, but the 40% having less than a year of experience, or 40% of health systems saying that a quarter of their nurses have less than a year of experience, did surprise me. That's a sizable number.
Yeah, so this is actually a more recent phenomenon. So the average age of a nurse in the US is 52 years, right? And we have 5 generations in the nursing workforce, from Gen Z all the way to the boomers, right? And there's over the next 5 years, 25% of nurses are expected to retire. So many health systems have had to really upgrade and push harder on their new graduate strategy, not only to build their pipelines into the more experienced workforce, but also just wasn't necessarily an option to just fill your entire nursing workforce with experienced nurses. From our experience, but before the pandemic, it was actually quite rare for an employer using Incredible Health to use the platform to hire new graduate nurses. But fast forward to 2023, and over 50% of the employers on our platform are using the marketplace to hire new graduate nurses, because they are also struggling with hiring new graduate nurses, not just the experienced nurses. So we can't take this new cohort for granted. They're a pretty important part of the nursing workforce now. They're becoming, increasingly the majority of the nursing workforce. And more and more leaders are putting strategies and tactics in place to increase the number of new graduates.
Interesting. And then you talked just a little bit about the younger workforce. I think one of the things that really stuck out from the survey was that health system. So and let me back up. When we did the nurse study back in Q1, I think we released that in March, where we surveyed thousands and thousands of nurses. Flexible scheduling was really important. It was one of the most important things to nurses. And in this study, that backed up what the nurses were saying, which is health systems say that 80% of younger nurses are requesting more flexible scheduling. Yet in the next question, only 11% of health systems said they actually offer what they define as flexible schedules. Now, I should say, we didn't define what the word flexible meant in the study. We simply asked if the nurses were asking for flexible schedules and if they provided flexible schedules. So there is some subjectivity there, but I also think it's even adds to the unique way to answer the question, which is systems no nurses want it, but only 11% say they're providing it to the nurses. Is this misalignment? Do you think that's overstated? And how much of this is due to that sort of new, younger nurse entering the workforce?
Yeah, it's I think there's definitely a disconnect between the hospital executives and what the nurses want, in terms of both parties might understand each other, but not all hospitals have implemented what it is that nurses want. The topic of the desire for a more flexible schedule is not just unique to the Gen Z and millennial nurses. Honestly, we're seeing it across the board with all industries, right? Those are just 2 generations that want more flexibility with work. And so nurses is no exception to that. The definition of flexible scheduling, to your point, is variable, right? So that includes offering part-time options. It includes not just having 3 days a week, 12-hour shifts full-time only, but also including weekend shift options and 8-hour shift options and 4-hour. And it's essentially, it's become for the 11% that are offering it, they are essentially offering a menu of options to nurses, not just the nurses that are currently working there, but also to the nurses they're trying to attract to the health system too, and saying, hey, like, we have it, all the options, just come join us, right? That is proving to be a very effective strategy, not just in hiring, but also in retention, in improving retention. And then the other thing that many health systems have in place is self-scheduling options, where the nurses can just has control over picking their own shifts. So now, obviously, the topic of flexible scheduling operationally is very difficult to manage internally at a health system. It does create more work and challenges for the nursing leaders. But there are technology solutions out there that help with that. And then also many nursing leaders have said, look, we just have to accept that this is the reality, and we need to take on this operational complexity of offering more flexible schedules in order to meet talent where they are.
Yeah, and it's interesting too, because I think it seems like there's it seems like the flexible scheduling adds complexity to everything from budgets to how you make a schedule and staff a floor. Like it seems like it adds complexity, which is probably why systems are hesitant to go fully into flexible scheduling. But I would stress too that they don't need to offer, you mentioned like several methodologies to offer flexible scheduling. Tell me if I'm wrong, but it doesn't seem like hospitals need to offer all of those. You could offer one or two of those methodologies to provide some additional flexibility that might be better than going full in on every option possible. Is that fair?
Yeah, absolutely. They don't have to implement every single option. And you're right. The reason it's only at 11% is because it's hard to implement.
Yeah.
Right.
Okay. Bonuses and salaries. So sign-on bonuses continue to be the primary method to attract nurses. 35% of hospital executives say they're now offering sign-on bonuses. And we did some work in the nurse study in Q1, and we can share that out as well in our follow-up email around the average amounts of those sign-on bonuses and what states are offering them the most and that sort of thing. And then 26% of hospital executives say they're increasing nurse salaries. This one to me is not surprising. Like the sign-on bonuses, that's something we're seeing more and more of. I was surprised that the 26%, I would have expected that number to be a little bit higher, given what we're seeing overall in the macro economy. Did you have any thoughts on these two pieces of data in terms of where they were you expected them to be as hospitals try to recruit nurses?
Yeah, I mean, certainly this isn't surprising, just given the shortage of labor. So when there's a shortage of labor in any industry, wages are going to go up. For sign-on bonuses, I think so. This study says 35% of hospital executives are offering them. The data from our marketplace shows that the hospitals that are using our marketplace are offering sign-on bonuses for 50% of the roles, and it's over half of the employers on the platform are still offering sign-on bonuses. The thing is, the thing about sign-on bonuses is that they're easier to get approval for because they're not an increase to the actual wage itself. They're usually one time, so it's just easier to handle. As far as just only 26% increasing nurse salaries, this survey was done in June of 2023. Hospitals did many wage increases in the last 24 months, prior to 2023. So I'm not surprised at that the percent of hospitals that are continuing to increase even this year has come down a bit compared to the last 2 years.
Great point. One thing that we talk about a lot that we didn't explicitly address in the study, but we've got a couple comments on is the impact of like nursing faculty and the impact that has on the nurse shortage broadly. You've talked about this quite a bit in some of the webinars you've hosted and some of the speaking you've done, the impact of nurse faculty shortage and the impact that has on the nursing shortage. Could you just address that? Because there's a couple of comments about it that I think are kind of interesting.
Yeah, absolutely. When we look at what is creating the nursing shortage and where are the main bottlenecks? We talked earlier about the retirement topic, which is also contributing to the shortage. We also another big, huge bottleneck is getting more Americans into nursing school. And one of the main reasons why nursing schools are not able to train more nurses is that they have a shortage of faculty. So that means that there's wait lists of tens of thousands of Americans who want to enter nursing school, but they can't because the nursing school does not have the capacity because of the faculty shortage. We're seeing some creative approaches here for how to address that. So in many locations, health systems are partnering with their local nursing schools and offering their own nurse managers and directors to do some of the faculty work at the nursing school. Now, obviously, that's there's a commitment from the nursing school to help the health system with their pipeline.
Right.
So
it goes both ways on that.
It goes both ways on that, yeah. But it is a creative way to try to address the faculty shortage because some of the most amazing nurse educators are actually working at the hospital.
That's interesting. So in some ways, this shortage is impacting, hopefully positively long-term, the cooperation between schools and hospitals and the education of nurses, which is great. Love that. Okay. This one I found maybe the most interesting part of the study. So sort of the generational chasm, we call it. And you even saw this as you compared the data in the nurse study and the hospital executive study. So 35% of hospital executives say that there are conflicts between the nursing generations, but also between the younger nurses and potentially older management. And here's a few areas where that manifests. So 78% of younger nurses say that 78% of younger nurses request salary increases versus 48% of older nurses. 54% of younger nurses are seeking specialized roles versus only 14% of older nurses. And then 74% of younger nurses request immediate career advancement versus 8% of older nurses. So this falls in line with a lot of the the data we saw from nurses as well based on age. It seems like the younger nurses are wanting faster career advancement, more money more quickly, and more specialized roles faster. And that's causing stress on the floors and in the system with their managers. No one was surprised to see this data that we talked to anyway. Is that fair?
Yeah, I mean, this data, again, is not unique to nurses or to healthcare.
Right. This is just broadly.
This is broadly, I mean, we run a
You
software
could do this
company.
at a technology company, you'd probably see the same thing.
Exactly. I mean, we're running a technology company and we experience the same thing. At the end of the day, the Gen Z generation in particular is a generation that wants to advance their careers much faster. For the nurses in particular, they don't want to spend multiple years in med surg or a more general role before specializing. They want to specialize right away, ideally right out of nursing school. They're also pushing for more and more salary increases. At the end of the day, we're all tackling and working with a workforce that has multiple generations. And that comes with a whole set of challenges in that different generations have different needs. And at the end of the day, I mean, navigating that is challenging. And as long as we all understand that this younger cohort has quite different expectations than the older cohort, and they are actually the future of the nursing workforce, we're seeing more and more health systems really accommodate their needs. So I'll give you a couple of examples, just maybe on the specialized role one. There historically, new nurses were just hired into med surg. New graduate nurses were hired into med surg. Now there are more new graduate programs that allow new grads to go directly into the specialty area, OR, labor and delivery, and so on. There's also more and more investment from health system executives that's helping them with their hiring and their retention of really formalizing career paths and career mobility programs for nurses. That means that when you join the health system, it is very clear, in many cases documented, for how your career is going to evolve and grow at that health system, versus it leaving it open-ended. More and more health systems are defining the career tracks, documenting it in the employee files, making sure there's a career mobility conversation at day 90 after the start date. They're being very, very intentional about this last one around being intentional about career advancement.
So what do you say because we've actually done some like hosted webinar discussions with CNOs, for example, who there's some like frustration around this. Like, how do you manage this when someone who's super young comes in and just wants to move really faster? That causes problems with some of the older, like, what's the right attitude to have about this? Because it seems like there's some extremes on this from this standpoint of people who are frustrated by managing this and others who are trying to figure out solutions where everybody can be happy with their career path. Like, how do you manage this? Because it does seem really, really challenging.
Yeah, it's definitely frustrating and challenging. I know you can see some of the names in the attendees. We have many nursing leaders and HR leaders on the call today who I know are facing these challenges every day. At the end of the day, we just have to acknowledge that the younger nurses are the future of the nursing workforce. Every HR and nursing leader is under a lot of pressure to keep improving retention and to keep increasing hiring. of permanent nurses. And so we have to capitulate, right? And at the end of the day, I think there's like a lot of hope here. I think this will overall be better for the nursing workforce in the medium term and long term too. Because you can make a pretty strong argument that we sort of underinvested or underfocused on the nursing workforce prior to the pandemic, right? And now we're seeing some of the impacts of that. So, for example, something like establishing clear career paths and tracks and formalizing all that is something that's pretty well established in other industries. I mean, in tech, you have to do that, like, or else you will lose all your talent, regardless of generation. But it's great to see that more and more health system executives are adopting these practices and putting more focus and investment on the nursing workforce. And of course, it affects patient care, but it also affects their bottom line too. Retention and hiring are two topics that have a direct impact on the hospital's P&L.
Great points. Okay, travel nurses. So 96% of health system executives say they plan to prioritize permanent nursing staff over temporary staff. And then 55% of hospitals say they did not increase the number of travel nurses over the last year, which we didn't do this. This is the first year we've done this study, but the majority now are not increasing the number of travel nurses over the last year, which is interesting. So I think it's pretty overwhelming that health systems want to move to the permanent nurse staff over temporary staff. It's just about finding the people to fill those roles. Do you think that's fair?
Yeah, I mean, look, the travel nurses and temporary staff have been considered for a long time as a band-aid solution, a temporary solution. And hospital executives believe, and we, even at Incredible Health, in terms of our focus, believe that the most, you have to focus on your core, which is the permanent workforce. And that's the main workforce that is delivering care, and it's critical for the culture of the organization too. Now, the travel nurses have that topic is, it's a topic with a bunch of landmines, of course, right? So there's a few. One is that the compensation is at least, in many cases during the pandemic, 3 to 4 times higher than permanent nurses. I think it's come down a bit. So now it's more like 2 times higher than a permanent nurse rate. So that, when a hospital runs on low margins, and so that's eating into their already low margins, right? So there's a lot of financial pressure to reduce travel nurses. Secondly, on the cultural aspects, it can be very frustrating on a nursing unit for a permanent nurse doing the same work as a travel nurse, but knowing that the travel nurse is getting paid much more, and that just creates angst and challenges, cultural challenges on the nursing units. And then third, and just in order to have a sustainable long-term workforce, you have to invest heavily in the permanent workforce. Even prior to the pandemic, less than 5% of nurses at a health system were travel nurses. It did go up to closer to 8 to 10% during the pandemic, but we're seeing it come back down to 5% or less of the total. And there is enormous pressure to keep reducing these premium labor costs, especially because there's financial pressures on revenue as well for hospitals and health systems. Great point.
Michelle asked a really good question just barely in the chat. Has there been any innovation in converting traveler nurses to permanent staff? Seems like that's a great recruiting methodology. Has there been innovation there? Has that been an increased focus for health systems that you've talked to?
Yeah, it's a great question. I can share some data just from the Incredible Health marketplace. I will say one of our most successful campaigns to attract nurses to the platform for the many hospital partners that we work with is encouraging travel nurses to consider permanent roles. At the end of the day, a travel nurse is maybe spending at most, maximum, maybe 1 to 2 years of their 30, 40-year career as a traveler. The rest of their careers are they're a permanent worker. And they are like the rest of us on this call. They have homes and kids, and like the idea of traveling for a long period of time is not really an option past maximum 1 or 2 years. And so yes, encouraging travel nurses to join to consider permanent positions is an important marketing tactic, honestly, in terms of talent marketing. And it has been proven to be very effective in converting travel nurses to permanent as well.
Love that. That's great. Okay, awesome. One thing I'll stress is in the chat, everybody, Danny, our colleague, has just shared the full healthcare executive study that you can click on and read more pieces of data. We're probably going to do another 1 or 2 webinars where we dive into different components of the study and comment on them. So stay tuned for those, watch for those webinars, and then you can read the full study in the link that Danny has shared. Just a little bit about Incredible Health before we conclude today. So as we mentioned at the outset, hospitals are using our custom matching technology to hire high quality permanent nurses in less than 20 days. So take that 95 or 89 or 92 days, whatever yours is at without Incredible Health, and we can get that down to the 20-day range. 700 plus hospitals and health systems are using Incredible Health from all over the country. We're just so honored to have so many great hospitals that we partner with. And then I love the way that we frame this, and I just think it's awesome. So employers are actually going into the platform and applying to candidates instead of the other way around. Nurses love that, and you get a great selection of candidates because of the volume of nurses in your market. So I think you said at the start that, Iman, we're 25% of the nurses are in the US are now part of the Incredible Health platform. So there's a lot of nurses on the platform ready to find their next role and ready for their next opportunity, which is I think really exciting. Anything you want to say just about how the platform works and this algorithm and proprietary screening process that we follow?
Sure. I mean, the last thing I'll just mention is that this is a very nurse-centric or candidate-centric model. And as we heard from the study earlier, there's more and more, I guess, asks from the nursing workforce. And a model that really, a talent acquisition model and strategy that's very nurse-centric is probably quite important for driving success today and into the future. We love partnering with nursing and HR leaders that have a similar philosophy around just like really prioritizing the candidate experience and who have a vision of ensuring that the nurse hiring experience is fast and easy and doesn't have a bunch of bottlenecks and so on. And so we definitely partner with our leaders, with many leaders on continuing to improve hiring operations too. And yeah, the beauty of the marketplace is that it's neutral and it's two-sided, right? And so that means that employers are able to apply to the nurses instead of waiting for the nurses to apply to them. That creates a very strong candidate experience. We have thousands of 5-star reviews from nurses on Google and Facebook and the App Store. They describe this as the best job search experience of their career. Now, on the other hand, talent acquisition teams are busier than ever. Each nurse recruiter is trying to fill 100 jobs at any given time. So we have to provide the technology of pre-screening and pre-matching them as well. And I see that many of our customers are on the call, many of our hospital partners are on the call too, from Cedars-Sinai, from Baylor Scott and White, from Providence St. Joseph. And so, yeah, thanks everybody for joining.
Awesome. I think this is a really interesting piece of data. Like even when future offers are higher in compensation, most candidates are going to accept their first offer. So speed is really the king here. And that is a big deal. One of the questions that we were getting from Mary Jo, she says, talk a little bit about retention rate post-placement and hire. So, because it's so easy for nurses to get hired through the platform, does retention suffer at all, or does retention match or even exceed what you would see if you hired a nurse through another source?
Yeah, the retention topic is important, and we believe we're accountable to that as well, right? This isn't just about nurse hiring. We have to make sure the nurses stay. We've actually committed now for all the employers that we work with to do a retention study every quarter, every 3 months, to really maintain a handle on what's happening. Overall, in summary, like our data that we see nationally is that the retention rates of the nurses hired through Incredible Health tend to be about 15% higher than the hospital's baseline. Now, obviously, it's going to vary by hospital partner, but on average, that's what we're seeing. There's 2 reasons for that. One is we tend to skew our nurse network to more experienced nurses, because that's 100% of employers are asking us for more experienced nurses. And experienced nurses tend to have stronger retention than newer nurses. And then the second reason is that the nurse was able to consider multiple opportunities before selecting a specific hospital to join. And so this is a very well thought out job search from the perspective of the nurse, as opposed to just taking the first thing they could get. So they could really think about what's best for their career. On the speed topic, the data that we see on our marketplace, and this is true in every single location where we're live. So in LA and Houston and Dallas and New York and so on, it is always the hospital that moves the fastest, that gets nurses through their hiring operations the quickest, that hires the most. Even more than the hospital that has the biggest brand in that market and the hospital that might have even the highest compensation in that market. Speed is, we can see in our data, is the most important factor in hiring nurses successfully. This data shows that 68% of nurses on our marketplace accept the very first offer they receive. And so I know many of the teams that are on the call have invested heavily in just really accelerating their hiring operations. They put in all kinds of best practices, like putting in SLAs and timelines between recruiters and hiring managers. They've allocated backup hiring managers, so even if a hiring manager is out of office, nothing gets slowed down. They've had the nursing leaders commit to same-day job offers. They've enabled the recruiters to directly schedule hiring manager interviews, and it's a really key partnership between the HR teams and the nursing teams in order to drive improvements in nurse hiring operations. It almost always takes both parties.
Do you think the nurses are accepting that first offer? It's probably a combination of these. As I asked the question, I'm realizing this, but like, it seems that it's a combination of the psychological factor of wanting to be wanted and people wanting to, they're going to skew towards the first person who thought they were interesting and liked them. Yeah, and then also it perhaps shows some efficiency and efficiency and the cleanness of the process. Maybe it makes them see the hospital in a favorable light. Do you think those are the reasons that people tend to go with the first offer they get?
Yeah, I think it's two factors primarily. One is just, it creates it's a perception. It creates an amazing perception of the employer. It's like, wow, I got hired so fast at Baylor Scott and White or Cedars-Sinai or wherever, right? And they just they sort of make an assumption that, hey, the entire health system must be working pretty well too, if I got hired quickly.
Right.
And so
everything must be awesome and streamlined.
Exactly. And so there is a psychological component to it. The second thing is just to keep in mind that nurses are busy. I mean, when a nurse is doing a job search, 99.9% of them are already working. And they are not just working, they're usually working overtime, and they're tired, right? So they are looking for a rapid experience and a convenient experience. That's honestly an expectation from the American consumer in general. I mean, there's so many experiences we have in life, whether it comes to our groceries and so on, where we get in online shopping and all that, like where we want an app, we want it to be quick, we want convenience and speed. And nurses need that more than ever because they are some of the busiest workers in the country.
Great point. And we'll move quickly through these, but this is just an example of a conventional hiring process versus the Incredible Health hiring process. It speeds up every phase of the process and allows you to source candidates much more quickly and complete the process much more quickly. And then you mentioned this a moment ago, Aman, with the retention rates, 15% higher retention rates at a year. And we're now asking our hospital partners to ensure that we know the retention of the nurses that were hired through the platform, so we can continue to track this. And then this is just another way to view the data, is like, what do we do versus what does the hospital do on the back end? Which is, I think, a great way to visualize it as well. So we've answered a lot of questions as we've gone, but I do want to address just a couple. Michelle asked a really good one as well. She says, is there any information on support for nurse leaders to develop resilience and become effective leaders? Things such as decreasing span of control, skill set mastery, so that retention does occur in the units. I'll just answer on the study specifically. We didn't really ask in this study, and this gives us good ideas of things to ask next year. In terms of nurse leaders, leadership development opportunities, decreasing span of control, et cetera. But that does certainly have an impact on retention, is how well the leader is delegating, how much they're including their team, and certainly skill set mastery and span of control. Anything you want to mention about leadership development amongst nurse managers and nurse leaders?
Yeah, so we've done we have a whole webinar series, speaker series that we do with CNOs and CHROs and CEOs across the country. And the CNOs in particular, in many health systems are focused on these topics that Michelle is highlighting. They tend to use information and data from nursing journals, right? Like there's tons of academic research on these topics around how to become an effective leader in nursing and how to drive resilience. There's also extensive materials from the American Nursing Association and from the Magnet organization too on these topics. And that tends to be the source of where many of the nursing leaders get some of the best practices here. You know, anecdotally, what many of these CNOs are saying is that, you know, investing in these areas has helped them improve retention.
That's great. Anything else you want to add before we conclude them on in terms of the study or just Incredible Health generally? Because you talk to so many nursing leaders, so many hospital leaders. Anything you want to add to conclude our discussion today?
I mean, the last thing I'll just add is just like hope, right? I mean, it's just, sure, the data is, you know, when you look at it at face value, it's pretty rough. The nurses are having a challenging time. Hospital executives have challenges, but I'm very hopeful for the future, right? Because this means that there's focus at the highest level, right? At the CEO and COO level on the nursing workforce. And that means with more attention means that there's going to be more strategies and more focus, and more things are going to get implemented, and stronger tactics and so on. So I'm actually quite hopeful for the future of the US nursing workforce. Now, obviously, we all have our work cut out for us to keep improving the experience for nurses and to, you know, help health systems stabilize their nursing workforces. But I'm definitely very, very, very hopeful, and it's great to partner with so many teams. Oh, look, the team from Adventist Health is on the call too. And then, the webinar is recorded, right? So a member of the Incredible Health team will be in touch with the recording. And then if anyone on the call is interested in learning more, please feel free. I know Danny on our team shared a link. You're welcome to schedule a call with us. You're also welcome to reach out to us. If you have any additional questions, please feel free to email us at questions@incrediblehealth.com.
Awesome. That's great. And Danny shared the link to the actual study a couple of times in the chat. We'll also email that out so you have that in your inbox. And then I think what we'll do is include the nurse study that we did in Q1. It's actually really interesting to throw, if you got two screens, throw the nurse study up on one screen and the employer study, the hospital executive study on the other screen, and kind of work through the data, because there's some areas that are so aligned, and then there's areas where there's misalignment between what nurses and what hospital executives are saying. So it's interesting to view it from that standpoint as well. So thanks again for taking time. We know everybody's busy, so thanks for taking the time. Hope this was valuable, and really appreciate you jumping on. Have a great, Wednesday, and a great rest of the week, everybody. See you later.
Thanks, everyone.